The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsor, Studio Arts and Glass, and, of course, our technical producer, J.D. DeAngelis. In the studio with me is Brad White, a compounding pharmacist, and our very special guest, Dr. Harry D'Agostino, cardiothoracic surgeon from Aultman Medical Group Heart Core, and medical director of thoracic surgery at Aultman Hospital. Good morning, doctor, and welcome to the show.
Thank you very much.
Cardiothoracic surgery, also known as thoracic surgery, is a field of medicine involved in surgical treatment of organs inside the thorax. The thorax is what we refer to as our chest. Generally, this would include treatment of conditions of the heart and lungs. This morning, we will talk with Dr. D'Agostino about heart and lung surgery as well as screenings. We'd like to remind our listeners that today's program is also available on our podcast, which can be downloaded from the App Store of your mobile phone. Look for Health Matters with the Medicine Center Pharmacy, and you can take our programs with you anywhere you go. If you have questions you'd like addressed, you can post them up on our live Facebook feed today.
So, Dr. D'Agostino, tell us a little bit about yourself. We know you came from Florida.
Not originally.
Okay.
I'm a native of upstate New York, in particular Albany.
Okay.
And
capital.
The capital.
Yep.
I've traveled around the country. I went to college at Harvard, and then I did my medical school at Duke University, so a big change.
Wow. And
then traveled across the country in various modes of surgery training, including Washington University in St. Louis, Kansas City, and then ending up at UCLA Medical Center for children's heart surgery and also heart and lung transplantation.
Wow.
And I was fortunate enough to be recruited to the University of Florida in Jacksonville, where I spent 20 years on the faculty before being recruited to here, to Aultman.
So what really brings you to Canton, Stark County, Canton, Ohio? And, you know, we got snow and stuff here, but you're used to that, I guess.
I am familiar with snow.
Okay.
This was an opportunity that was just too good to pass up. I was looking for a new opportunity, and the Aultman one came up out of the blue. And when I went to tour the facility, I was just amazed at the resources that they have. The Cardiothoracic organization has 4 dedicated operating rooms in a separate part of the building. Right next door is the cardiovascular intensive care unit and the step down. So the physical plant was tremendous. The size of the program was excellent, as well as the volume. A good surgeon wants a lot of volume, and they provided that. The other thing that impressed me is that we had a dedicated team. We have an army of people in the operating room to help us with the surgery. That includes nurses, anesthetists, anesthesiologists, all dedicated and all trained. And then after surgery, just as important, is what happens to the patient. So we have, again, a dedicated team in the cardiovascular surgical ICU and the step-down, nurses and respiratory therapists and others that all help us with our patients. So it was a tremendous opportunity, and I just couldn't pass it up. The other thing that attracted me was the Aultman Cancer Center, which is a dedicated cancer center and has its own excellent organization.
So what conditions do you treat at Aultman? I guess what is your goals and things like that?
Well, as a cardiothoracic surgeon, obviously we treat diseases of the heart, but everything else that's in the chest as well. I do both heart surgery and all of the other types of surgery, which we call non-cardiac thoracic or just simply thoracic surgery. The bulk of my practice has evolved into non-cardiac thoracic surgery, although I still take call and do heart surgery quite regularly.
And what about heart and lung issues that you treat most commonly?
Most commonly, I see a lot of coronary disease on the heart side. Also, I treat a lot of atrial fibrillation. There are a number of surgical procedures for atrial fibrillation. On the thoracic side, we see a lot of lung cancer, which I treat very routinely, and also a lot of other diseases of the chest, which are treated as well surgically.
Wow.
Let's focus on lung issues for a moment. Are there common conditions you see, and if so, what are some of those issues?
Well, first, of course, is lung cancer. We see a tremendous amount of that all over the country. I see a lot of it in Stark County. We also have the so-called benign diseases of the chest, which include fluid collections, which we call pleural effusions, and infections of the chest, which can result from pneumonia or other causes. In addition, obviously, we see a lot of chronic obstructive pulmonary disease, or COPD, and the complications from that, and often I'm called to operate on those patients as well.
When or why should a patient have a lung screening?
First of all, it's important to know that lung cancer is a deadly disease, and it also doesn't really cause symptoms that brings it to the attention of the patient or the physician until it's usually advanced. And by that time, it's not curable in general. So screening was initiated to look for patients who are at risk, who might have small cancers, small lesions that can be identified and treated surgically with the hope of increasing the rate of cure. So in terms of who would be screened, in general, first of all, we're looking for smokers. That's the highest risk group. In general, the recommendation is that they be between the ages of 55 and 74 and have at least a 30-pack year smoking history. Now, what we mean by that is the number of packs per day multiplied by the number of years of smoking. So a 30-pack year would be, say, someone who smoked a pack a day for 30 years, or someone who smoked 2 packs a day for 15 years. It's the same amount of exposure and the same amount of risk. So those are the conditions which we like to offer screening. Most of the major health insurers do cover screening, and most of the primary care physicians are keyed into this and are very active in encouraging their smoking patients to have screening.
Can you talk just briefly about what a screening looks like from the patient's perspective?
Basically, it's a CT scan. You lie on a table, and you go in and out of a large metal donut.
Okay.
It's very quick. These days, the CT scanners are very quiet, and they're also, they have low-dose radiation. So they're called low-dose CT scanners. The amount of radiation you would pick up would be as if you were out in the environment picking up cosmic radiation or from the environment for about 6 months. So it's not that much radiation. It takes about a minute to do, and the results are available within a few hours and can be analyzed by the radiologist and your physician.
So we see the front and the rear of the lung picture, or not?
We say actually everything. It's a two-dimensional picture, but it's done in 3 dimensions. So one way we look at it is much like a bologna slicer at the supermarket. You know, they take a tube of bologna and they put it on the slicer, and you get slices, and it goes through the entire tube.
Okay.
The CAT scanner does that, and we see each slice of the patient, so we can look through the entire lung. The CT scanner also has a computer support system that will allow it to change the image, so now you can look at the patient from the front. But again, you go in slices, so you start at the front, and you take slices all the way to the back, so you can see, again, the entire lung, the heart, all the structures in the chest from front to back.
Wow. It's amazing.
What can people do to prevent lung issues?
Well, biggest thing, of course, stop smoking. Everybody knows that. Everybody says, I'll do it. It's extraordinarily hard. Fortunately, these days, our understanding of addiction medicine is much better than it used to be. There are lots of behavioral therapies. There are lots of nicotine replacement therapies. There's a big push to stopping smoking. It's encouraged by the insurers. So this is a great time to try to quit.
Many of the insurance companies rather penalize you, I think, if you're a smoker. Is that correct?
That's correct.
Higher premiums or something like that.
That is correct.
Okay. I don't know how common that's become, but it hasn't been real often here since it started. Can't think, somebody was telling me about that they had to pay a lot more, and I can't remember what it was. So why do you smoke?
That's a good question. Coming from someone who's a non-smoker, I can't really tell you.
I know. It's just amazing to me that the young people too, which is just crazy. Yeah.
Well, let's talk a little bit more about smoking. We know that smoking is bad for people and causes COPD. What about the people affected by secondhand smoke and issues they may face?
Well, that's true, because I will see patients who have lung cancer who'd never smoked. But they will tell me that they were in an environment where they were exposed to secondhand smoke, such as when they were growing up, they were in an environment where a parent smoked, or perhaps they encountered smoke at work. And the risk for non-smokers is increased with secondhand smoke. We believe that's 20 to 30%. Some of the statistics indicate that over 7,000 deaths are attributable to secondhand smoke. So it is a problem. Now, the public has gotten involved in this in public policy, so you no longer see smoking at restaurants. You don't see smoking on airplanes, workplaces, things like that. So the government has done a lot of work to improve that situation, the environment, but we can do more.
I remember sitting in an airplane in the non-smoking section years ago. It's not non-smoking anywhere in this airplane.
That's correct.
Because it's all over the airplane,
Well, it's a closed ventilation system, so you can't get away from it.
Well, sure. So it's okay, crazy.
What about what are some of the statistics regarding lung cancer? And I guess I'm wondering, you've just highlighted how smoking is the number one, and it sounds like secondhand smoke is a pretty high percentage also. What about environmental situations? I guess, do we have people working in steel mills exposed to things like they were 50 years ago, or is there data for that?
Well, there's a fair amount of data, but it is often hard to piece together because these environmental issues have become more prominent only recently, whereas most of the people who were working in the past. I see a lot of people who are exposed to asbestos, in particular people in the Navy who were either putting asbestos into the ships or taking it out, and they were not using protective masks because nobody knew. What's worse is many of these people were also smoking, so the combination of asbestos and smoking is what we call synergistic. That is, the combination of the two is greater than either one alone. The other common cause is radon. It's naturally in the environment. It's part of our background radiation. That's why you get your house checked for it. And radon is also a contributing factor. There are a few small others, such as being exposed to uranium, but there's very little uranium mining anymore. And also coke used in steel furnaces has been implicated as a factor, but very few people are exposed to that. But there are other exposures and environmental factors that we don't know about.
Okay, Doctor, our first break's here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Men like Paul White love Studio Arts and Glass. Why? We wrap all of his gifts. Gifts like hand-blown paperweights, ornaments, jewelry in stunning sterling silver and precious stones like amethyst and crystals. After 30 years, Studio Arts and Glass is known for creating and restoring stunning stained glass. Just ask Paul White. Studio Arts and Glass on Apple Grove and 77 in North Canton.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are discussing thoracic care with Dr. D'Agostino from Aultman Medical Group. Have a question?
Okay, well, before the break, we were talking about lung cancer, and I really am fond of statistics because I like the data. So how about you share some statistics regarding lung cancer, please?
Certainly. Well, worldwide, it was estimated in 2018 that there were 2.1 million cases of lung cancer. And there are 1.8 million deaths. So if you calculate that out, that's about 85% of the people dying due to lung cancer. It's a very aggressive disease. In the United States, we see a similar picture, about 234,000 cases diagnosed in 2018 estimated, and about 154,000 deaths. So it's a very aggressive disease. It is the number one cancer killer of both men and women. A lot of people don't know that. They think breast cancer is the number one cancer for women. More women get it, but they don't succumb as easily as they do to lung cancer. In the United States, over 500,000 people will have received the diagnosis of lung cancer at some point in their life.
What about what are the latest developments in lung cancer diagnosis and treatment?
Well, one of the things that I have noticed is the use of targeted therapy. This, in general, is for cancers that have spread and are being treated with chemotherapy. There are now other agents that are targeted specifically at the various characteristics of the tumors themselves. You can actually see some of these ads on television. If you have a certain type of cancer with a certain type of marker, then this particular drug might be helpful for you. Again, those are often designed to slow down the progression of the cancer, and patients can live longer. So you're living with the cancer rather than eradicating it. The other tool that's been really strong in my mind is screening. That is, lung cancer doesn't present with symptoms until very late, so if you can catch these patients early, the chance of cure is much, much higher. We think that about 8 million people in the United States are candidates for screening based on those criteria I gave you, ages 55 to 74 and a 30-pack-year smoking history. And if half of those people were screened, we would prevent 12,000 cancer deaths. So a big impact. The other advance, which for me has been the most important, has been the use of minimally invasive surgery in dealing for lung cancer. That's been around for at least 20 to 25 years, and I've been privileged to be involved in that for that period of time, and the techniques kept getting better every year.
Well, what do you mean by minimally invasive?
In general, it's the surgery done through small incisions and a television camera. Okay. Everyone's heard of a laparoscopic gallbladder removal. This is the exact same thing, but it's in the chest. We make small incisions. We go in between the ribs. We can see the entire lung. We can put in instruments. We can find a mass or a nodule and remove it, see what it is. If it's a lung cancer, we can treat the patient for lung cancer, which typically means removal of the entire section of lung in which we found the cancer. We traditionally call that a lobe. In addition, we also remove lymph nodes from the center of the chest to make sure the cancer has not spread to those lymph nodes. That's part of what we call lung cancer staging. And it has been a tremendous advance. Previously, we used very large incisions on the side of the chest, which we call thoracotomies. The incision went from essentially the tip of the shoulder blade all the way around the front to near the nipple. Wow. A lot of muscle was cut. Ribs were spread, sometimes removed, sometimes broken. A very big, painful incision. We just don't see those anymore. Yeah. At Aultman, I'm pleased to say that we do 98% of our minimally invasive surgery, and we have to open only 2% of the time.
Wow.
Amazing.
And I'm sure that contributes to lower complications and faster recovery times and less infection risk and all those good things.
And certainly less pain.
And certainly less pain. Every breath, right?
Yes.
Wow.
Most patients will take some pain medication for the first week, and then they don't need it anymore. They'll take Tylenol. And the other thing that's a really big plus is a rapid return to full activity, whether it was work or sports or whatever the patient was doing beforehand. We expect in a few weeks that they'll be back to doing what they were doing before.
Neat.
Do you have any sense on what the steel mills and that sort of thing are doing to protect their labor force from, the fumes and the dust and all that sort of thing? I know the EPA and a bunch of other people in the government have been involved in sort of cleaning up some of these places, but
I don't have a good feel for it, but the Occupational Safety and Health Administration, or OSHA, I'm sure is very heavily involved in all of this.
I happened to be in one of them on a tour some time ago, and I was really surprised to see that a few of the people in the labor force were wearing respirators, but there was another half that wasn't. And I thought to myself, in the course of the tour, I thought, man, this is really an acrid environment. Of course, not working in it every day, I guess, caught me more off guard than anything else. But I'm surprised that they aren't running around with oxygen masks on. I mean, is that doable?
Well, it also depends where these workers were actually working and where they're expected to go. If they're going to be close to the source of environmental concerns, their protective equipment will be more involved.
Sure. Okay. So we've got about a minute here before the next break. Any additional thoughts on diagnosis? Anything coming down the road, or without totally opening up the chest and that sort of thing? What are we seeing?
There are a couple of diagnostic maneuvers that are coming about. I've been aware of some research involving sampling the gases that are exhaled, looking for particular compounds that are emitted by lung cancers. That's very early on and not yet clinically applicable. The other is the use of a special bronchoscope. This is a flexible lighted scope that's passed down the windpipe and into the various branches, the bronchial tubes of the lung. Again, with the idea of getting close to the mass that's of concern and then sliding a needle out and biopsying it. Wow. We've had bronchoscopy for 50 years, but the newest ones are called navigational bronchoscopy because they're very flexible and they're also guided by fluoroscopy, so you can get the bronchoscope very close to the lesion, far out in the lung tissue, and biopsy. That's being done at a few centers and is growing rapidly.
Good. Bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White from the Medicine Center Pharmacy. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacists can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
We've extended our most recent sale at the Half Off and Hot Buy store in Louisville and have added a lot of new items. All lift chairs are reduced to $199 with many in stock. All seasonal merchandise is drastically reduced, as well as a wide selection of health and beauty products, cough, cold, and vitamins. And shop our tool aisle and toy aisles to find more bargains. Take time to shop our store and you'll find many, many values. The Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are discussing lung disease and screening with Dr. D'Agostino from Aultman Medical Group. We've got a lot more to cover this morning, so let's get back to the show. Doctor, I know you've had some experience in pediatric thoracic surgery. Can you mention vaping and concerns sharing the news about vaping-related disease, especially in adolescents?
Yes, I'm concerned both as a physician, because it is becoming rampant, and also as a parent. I've got two children who are in that category, and they are seeing vaping all over. Both my wife and I are healthcare professionals, and we've had many talks with our children about the smoking and now about vaping. It's a concern. Right now, the data is very discouraging. There have been about 2,200 deaths reported, 2,200 cases, 47 deaths. And I know of at least one patient who underwent a double lung transplant for a vaping-related illness. So this is a problem. There's even a new disease that was just named. It's called EVALI, E-V-A-L-I, and that's a very complicated acronym for e-cigarette or vaping product associated lung injury. And it is a lung injury. It's sometimes called popcorn lung.
What does it do? I mean, what does the vaping do to the lung?
Well, that's still being investigated, but it appears that it injures the small airways, what we call the bronchioles, the tiny airways, and perhaps the alveoli, the little air sacs as well. The medical name for that is bronchiolitis obliterans. And if unchecked, it can be quite deadly.
So it burns them out or destroys them?
It inflames them, and then they close up. So that's a problem. The lung injury is real, and we're just beginning to understand it.
This has all just kind of come on the scene in the last few months or the last year that the damage is coming out. And am I right about that? Or
it seems so. Vaping's not been around that long.
Yeah.
In fact, smoking was around for a very long time before we finally figured out that it had an association with lung cancer. This has come about much more quickly, so obviously raises concern for an even greater and more rapid progression of damage.
So part of the smoking thing is this hand-to-mouth thing. Yes, no, or... I remember reading about this some time ago. And okay, so we left cigarettes and we went to vaping. Okay. But we're still the hand, mouth, and motion, whatever. Is that supposed to be cool, relaxing? I mean, why are all the kids picking this up?
I don't know. Maybe it does look cool. There is a lot of peer pressure involved. It's widely available, and everybody's doing it, so everybody wants to do it. It's been touted as a safer alternative to cigarettes, and now we're finding out that that's not the case. We don't know all of those compounds that are in those vaping solutions, and we don't know what the lung injury is. It does appear that vitamin E may play a role in the lung damage. When we take vitamin E as a supplement, it has some health benefits when taken by mouth, but when inhaled, it can have a problem. Also, a lot of these cases of lung injury have been associated with THC, that is the active ingredient in marijuana. Also, we think the flavorings may be involved. Those are chemicals, all sorts of chemicals that are totally uninvestigated. And I think that's why the ban is right now on most of the flavorings.
Yeah.
But menthol and nicotine are still available.
Now, do they have nicotine in them very much?
Some of them have nicotine. And just recently I saw a study where vaping-related nicotine compounds cause lung cancer in mice. Mm-hmm. So that's a concern. There may be another direct correlation between vape nicotine and lung cancer.
Continue punishing our bodies. It's just crazy. I can't get over it. So, current outbreak of what? Lung disease linked to vaping. What are we getting? Is it causing pneumonia, or is it making it worse, or bronchitis, or all this stuff that we normally had before we punished our lungs?
Well, lung injury, usually associated with shortness of breath and decreasing oxygenation. So those are very dire signs requiring hospitalization. We do believe this is some type of inflammatory condition, and often it's been treated with high-dose steroids, which are important for controlling inflammation, but they have their own side effects.
So what are we looking for lung disease symptoms? I mean, what should we be aware of?
In general, from the lung symptom side, if you notice your teen or your child is having a cough for no good reason, and it's protracted, or if they have shortness of breath, and they really shouldn't because most children are healthy, or if they're having chest pain, that should be cause for alarm. Sometimes the symptoms of vaping-associated illnesses are not in the lung, and they can include general things like fever or chills, or even weight loss. So they may not come to the attention of the physician right away. So it can be a very insidious process.
So all the treatments available to stop smoking and over the years that have come about, the patches and the medications, oral medications, can we use these same meds for anti-vaping?
Probably, but again, the information is very new. We think that behavioral therapy might help for those individuals who are using nicotine products. Nicotine replacement therapies, which are very common on the market, may be helpful as well. But this is a brand new area treating an addiction of vaping.
What would you tell parents? Talk to their children. What's your approach?
Well, certainly you talk to your children about the dangers, but also I think you need to be a good role model. So if you're smoking, you need to stop.
Quit.
Absolutely. And also be aware that there's a tremendous amount of peer pressure, as there has been with all types of drug usage in young people.
Amazing.
Okay, on a more positive note, what developments and treatment have you have had the most impact on you in treating and taking care of your patients?
Again, as far as vaping concerns, I'm very fortunate I haven't seen any vaping patients of my own. And that would be a very disturbing thing if I had to operate on somebody who has a vaping-related illness. Fortunately, that's not been the case so far. As far as lung cancer patients, certainly the minimally invasive surgery has been the biggest boon for me. It is a real pleasure to be able to take care of these patients, give them a curative operation, and do it with small incisions so they can be out of the hospital in a few days.
You mentioned you treat cancer patients. Tell us a little bit about the Aultman Cancer Center.
Yes, well, that was one of the reasons that I came to Aultman, was because of their cancer center. I had been privileged to be associated with a similar organization in Florida. One of the things that impressed me the most is their approach using multidisciplinary activities for a single organ, for example, lung cancer. We have a multidisciplinary conference twice a month, and it's attended by everybody who's involved in the treatment of lung cancer. So we have the medical oncologists who handle the chemotherapy and the monitoring of patients. We have radiation oncologists, obviously using radiation. We have the radiologists who are very helpful in diagnosing the patient. Pathologists who look at all the material, tell us about the tumors, what kind, what kind of markers it may have. They're indispensable for the treatment. Obviously, we have a surgeon. I go to those meetings. And one of the most important individuals, pulmonology, because they're going to be identifying a lot of these patients. But we also have something called a patient navigator. This is a nurse or a series of nurses who are highly trained, and they help the patient through the process. Quite often, a patient will see multiple different physicians, need multiple different tests, and you want to get that done as quickly and efficiently as possible. And sometimes going from physician to physician, getting a test, seeing another physician takes a long time. And you don't have a long time with lung cancer. You've got a diagnosis, you want to get on top of it within a few weeks. So this navigator is the person who coordinates all these tests and all these physician visits and makes sure that each patient is handled completely, gets all the things that are needed, and can get on the track to a treatment plan. That's the other thing I like about the multidisciplinary conference is we figure out the best way, in talking about a patient, the best way to diagnose them. What's the most efficient way? Is it by this bronchoscopy, the lighted scope, or is it by a needle through the chest guided by a CT scanner, or is it by a surgery with a TV camera to take out the lesion? What's the best way to diagnose it? And then what's the best way to treat it? Is it surgery? Is it radiation? Is it chemotherapy? Or is it some combination of the three?
Our final breaks here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Men like Paul White love Studio Arts and Glass. Why? We wrap all of his gifts. Gifts like hand-blown paperweights, ornaments, jewelry in stunning sterling silver and precious stones like amethyst and crystals. After 30 years, Studio Arts and Glass is known for creating and restoring stunning stained glass. Just ask Paul White. Studio Arts and Glass on Apple Grove and 77 in North Canton.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us today. And let's get back to the last segment of the show.
What are some other diseases of the chest that you treat, doctor?
I'd say about half of the lung practice deals with fluid in the chest, and this is in between the lung and the rib cage, the area that we call the pleural space. A lot of times inflammation will build up fluid in that area. Normally there's a small amount of fluid. The lungs are, of course, expanding and contracting, and they touch the rib cage, and they slide along the rib cage with a thin layer of fluid. It's well lubricated, much like a piston ring in a car. When something happens and too much fluid is produced or it's not absorbed, then you get buildup of fluid in the chest that can compress the lung and needs to be removed. Often it can be drained very easily. Sometimes if it stays too long, it contains a lot of protein, and that protein can start to solidify the fluid, much like Jell-O. Then it won't come out a needle or a catheter. It won't even come out a tube. It has to be physically removed, and that's when I go to work with the TV camera and take the fluid, the solidified fluid, out. Often that fluid can become infected, so the space in between the lung and the chest wall is infected. We have a medical name for that. It's called empyema. Yes. And those really are not treatable with antibiotics. The infected material needs to be physically removed from the space. There often is scarring on the lung. That has to be removed so that the lung can expand to fill the space. And then we leave in drainage tubes to make sure the lung stays expanded. And that can be done with a TV camera and small incisions.
How large are the lungs, and how large is the chest cavity?
Well, each lung takes about 2 quarts of air. So that's the size of the lung. That's in the average person.
Okay.
Yeah, so 2 quarts or half a gallon.
When it expands.
When it's fully expanded, yes.
Okay. So we hear once in a while about a flattened lung. Okay. Is that true? I mean, does it actually flatten?
It can. The lung is like a balloon, and what holds the lung expanded is the fact that there is no air leaking into the space between the lung and the rib cage. If, say, one of these air sacs pops, or if the patient has COPD and has a large bubble on the lung and that pops, all of a sudden air leaks into the chest, the lung collapses, and the more air that gets in, the more it collapses, and sometimes the lung can collapse completely, which means the patient is now living on just one lung.
So we can repair that?
It can be repaired, but the very first thing you do is insert a tube to take the air out and get the lung to expand.
I see.
And then if the area of injury or where the lung ruptured can heal itself, that's fine. If it doesn't, then I go to work. Again, with the TV camera and small incisions, we find the area that's leaking. We can seal that up with a special kind of stapler that cuts the lung tissue and seals it up at the same time.
Why does it happen? I mean, why do you get a collapsed lung?
Several different reasons. In young people, some people just have that kind of lung that tends to rupture in small places. Some are born with bubbles on the surface of the lung or develop them later. We see that very commonly in thin male patients who are young, say in their teens and 20s. And also they often have a history of very light smoking. The second group of patients we see are in the older population, say 50 and above. And those are the patients usually have emphysema, COPD, and have a lot of large bubbles on the lung, which we call blebs or bully. And those can pop and, again, cause the same problem. So when we operate on those, we remove those bubbles. The other thing we do is to rub the inside of the rib cage, and what that does is it sets up an inflammation. So when the lung re-expands to fill the space, it will heal against the rib cage and stay in that position. So if something else tries to pop, then the lung cannot fall down.
I was visiting a friend some years ago, and he had lung cancer. And the doctors chose to put talcum powder in his chest cavity. Is that like a lubricant or?
Oh, not a lubricant. That's very much like rubbing the inside of the chest. Talc is very abrasive.
Okay.
And what it's designed to do is, again, set up this inflammation on the inner lining of the rib cage so that the lung will stick to it. Sometimes we do that with air leaks from the lung for people who have chronic obstructive pulmonary disease, or if they have lung cancer and they're continuing to produce fluid. If we can do the same thing and irritate the surface of the lung and of the rib cage, we can get the two to seal together so there's no place for the fluid to come back to. Now, more recently, they have developed an indwelling catheter, a soft plastic tube that can sit in the lung space and then come out of the body and just be worn under a little dressing. And that can drain the fluid, and the patient can drain it every day and keep the fluid away. That's as effective as talc, but it works faster, and we can get the patient out in a much shorter period of time.
Well, talc isn't an absorptive product, is it?
No, it is not.
Yeah.
And a lot of talc is impure, so there may be some asbestos contaminant in it as well.
Gosh.
Wow.
Wait a minute.
Yeah, well, that's something we have to be aware of. Now, if it has asbestos, asbestos long-term causes obviously its own set of problems,
Sure.
including mesothelioma. But those occur maybe 20 years down the line. If you're doing it in a patient who has lung cancer and is having these continuing fluid buildups or effusions, that patient probably is not going to see that 20-year mark. So we don't worry about it in that case. In general, I've gotten away from talc. Sometimes it's hard to get a hold of it. And most of my practice is involving these catheters or using the rubbing of the inside of the chest wall, and I find that just as effective as talc.
It's amazing.
What about on the horizon? Do you have any closing comments to share with patients or listeners about exciting things happening at Aultman Medical Group or in your specific field of practice? Or
Certainly. Well, we're always interested in future growth. We want to be more. One thing we do have is the robot at Aultman Hospital. We actually have two now. And the robot is a tool. Again, it works through small incisions, just like my TV camera and my instruments. And I use that for certain cases. There are certain cases where the robot does very well in taking care of lung diseases. There are certain cases where the robot does not do all that well, in which case I'll use the other techniques. But that's available. The other thing is Aultman wants to be and is working very hard to be the regional referral center where we take in all the patients and can handle all of their problems. And one of the things that I like, obviously minimally invasive thoracic surgery, when I came here, we really didn't have a minimally invasive thoracic surgery program. And when I got started, got all the instruments and trained all of the team members, the nurses in the ICU and the OR, all of a sudden we have one. And later on, an administrator came up to me and said, you brought a program here that we didn't know we needed. And now we have it. So my goal is growth. We certainly serve the 5-county area, but we want to expand. To the best of my knowledge, there's not a whole lot of other minimally invasive thoracic surgery being done in various areas of the 5-county service region. We want to get the word out and get more patients in to have minimally invasive surgery if they need it.
Exciting. Well, we appreciate you being a guest today. Do you have where can we learn more about Aultman Medical Group and your practice?
Simplest way is to go online, www.aultmanmedicalgroup.com. It's all one word, all in lowercase, and that'll get you. It'll have some information about me and my contact information. You can call the office. We can talk. Also, you can Google me if you want to. Somebody put me on Google. So I'm surprised about how easily I can be found.
Wow.
Very good.
All right. Thank you very much. Our special guest today, Dr. Harry D'Agostino, cardiothoracic surgeon from Aultman Medical Group, Heart, Core, and Medical Director of Thoracic Surgery at Aultman Hospital. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsor, Studio Arts and Glass, and of course our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters. The Medicine Center Pharmacy. Have a healthy week, and we'll see you right here again next Friday on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.